If you feel constant discomfort or pain between your toes and in the ball of your foot, you may be suffering from a condition known as Morton's neuroma. A neuroma is a benign growth of nerve tissue frequently found between the third and the fourth toes, but it can occur between other toes as well. Those suffering from a neuroma, also referred to as pinched nerve, find it difficult to walk and often describe the pain to be similar to having a pebble in their shoe. The most common symptom of a neuroma in the foot is pain in the ball of the foot, especially when walking in closed shoe gear. Some people can also develop tingling, burning, electric sensation, or numbness in the small toes. Some of the common causes of a neuroma or a pinched nerve in the foot include biomechanical deformity of the foot, such as having a high arched foot or contracted toes and bunions. Second, there could be a history of direct trauma that caused nerve damage or swelling of the nerve. Another cause could be improper shoes, which can cause the toes to squeeze together, such as high-heeled and narrow shoes. And finally, repeated stress, irritation, or pressure to the ball of the foot from certain high-impact activities, such as running sports, can also cause a neuroma to form in the foot. At our office, we perform a thorough history of your signs and symptoms, and we perform a complete physical exam of the painful area to arrive at the proper diagnosis. Some of the tests we perform in our office include x-rays and sonograms of the foot to rule out the causes of the pain in the ball of the foot and to confirm the diagnosis of Morton's neuroma. Once diagnosed, most neuromas in the foot can be treated by conservative measures. Surgical management may be needed in less than 10% of the cases. So, what are some of the conservative ways to address the pain of a neuroma? The first one is to avoid wearing high heels and tight-fitting shoes. Also, using shoes with flexibility in the toe area is important. All this helps to decrease the compression of the nerve. Another way to relieve pressure on the pinched nerve is by using a pair of custom foot orthotics. At our office, we customize the foot orthotics based on the individual needs of the patient, adding various types of padding to lift and separate the metatarsal bones in the front of the foot so as to decrease the compression of the nerve. Another way to provide neuroma pain relief is to use oral anti-inflammatory medications or receive a few sessions of pain laser therapy in our office. Finally, local cortisone injections could be administered in between the toes to decrease the swelling and inflammation of the nerve. I have found this to be a very effective way to quickly resolve the pain of neuroma. If conservative treatments fail and neuroma pain continues, surgery may become necessary. The surgical procedure for Morton's neuroma consists of removing the enlarged and swollen part of the nerve and releasing the soft tissues that surround the nerve. This can usually be done on an outpatient basis, and the recovery time is usually about few weeks. At our office, we always try conservative measures first. I suggest surgery only when it is absolutely necessary. So if you suffer from pain in the balls of your feet, come on in for an evaluation. Early diagnosis and treatment of a Morton's neuroma is the best way to avoid surgery.